I personally, I have been involved in Alzheimer's research, clinically applied Alzheimer's research for more than 35 years by now, yeah. And I think this is still a very, very important area of research. It has not received as much attention as cancer research, for instance. However, it will be one of the most important diseases of the upcoming years. Yeah? So it is really a big effort which has to be taken by all what is usually called stakeholders, clinicians, researchers, industry. They all definitely have to work together to get more effective treatments. This collaborative effort, yeah, has changed a bit in the recent years. Yeah? So there is a much more preponderance on the side of the industry, who is forced and restrained by the huge monetary sort of input they have to give. Yeah? And so this interaction between clinical researchers and industry research has shifted a bit. There is maybe a difference between the perspective in the United States and the European perspective. In Europe, the general treatment for patients is much more supported and solidarically seen in terms of the societies, while here in the United States, a number of the patients who have no benefits in terms of health insurances or so, they really rely on taking part in clinical trials for their personal sort of treatment of other diseases, yeah, excluding them, treating and correcting them. And so there is a bit of a force on the clinical sides coming from this US-American perspective to sort of simply perform what is done in a clinical trial in a correct and reliable and so on fashion, rather than seeing that this is also a collaborative scientific collaboration between clinicians and industry. And that was part of our poster, to pick up what issues there are in the perspective of the clinical research sides in the collaboration with the industry.